It's DFW Child Baby Day, and I am happy to be here with Chris Croteau. Chris, you are Assistant Vice President and Director of Women's and Infant Services at Medical City Dallas. And Chris, you are also one of this year's Great 100 Nurses in DFW. We are so glad to have you with us today.
Thank you. So glad to be here.
And we thank you for your support and the support of Medical City Healthcare as a whole. So, Chris, we're going to talk about something really important today, and that's postpartum depression. So a lot of people think of having a child as this amazing, beautiful, wonderful thing. And it is wonderful, but new moms don't always feel wonderful. So talk a little bit about what causes postpartum depression.
Sure. I think the most important thing to note here is that there's nothing that a mom did to bring this upon themselves. So we have to keep in mind that this is caused by a sharp drop in hormones. So we're talking about a drop in progesterone and estrogen. And also some hormones that are released in your thyroid can also cause postpartum depression.
So it's normal to have some anxiety and stress when you have a new baby in the house. So how do you know as a mom if you are having postpartum depression or if you're just having a bad few days?
Sure. Sometimes those bad few days, we refer to those as the baby blues. And so baby blues are characterized as feelings of being overwhelmed, having some mood swings, maybe some crying spells, sadness, anxiety, those types of things, maybe difficulty sleeping. So generally those things, kind of things you can pull yourself out of, right? You notice that, I'm spending a lot of time in bed and I probably need to go ahead and get up and go for a walk. So things you can kind of pull yourself out of, we consider those to be baby blues. And usually those last just for a couple of days up to 2 weeks. Beyond that 2-week time frame, if you're still struggling, your symptoms are getting worse. Your severe mood swings, excessive crying, difficulty bonding with your baby, family and friends, you're withdrawing from them, those types of things, loss of appetite. So when we've reached that point, it's become postpartum depression. There may even reach a point where you feel like harming yourself or your baby, and that's a big trigger, a big red flag. We want to make sure that you get back to your physician to get that serious help that you need.
So when would the symptoms show up? Is this something that you would normally get a sense of even while you're still in the hospital, or is it something that comes up after you're home with your baby and kind of settled back into your routine?
Yeah, that's a really good question. So keep in mind during the hospital stay, you've got someone taking care of mom, you have someone taking care of baby, you've got meals brought to you, your room is cleaned. And so all of those things, while still overwhelming, you've got kind of a centralized focus on nursing care. When you get home, all of those things are now your responsibility. And on top of that, you're caring for this new baby. And so we do tend to see postpartum depression occurring after moms get home and in that first few weeks leading after that time home. We're dealing with all of those same chores. And now we've got all these emotions and they're tired. And so it tends to compound after they get home from the hospital.
And after they get home from the hospital and you said they're dealing with all of those new tasks and responsibilities that come with an infant. In addition to all of that, right now we're in a pandemic. Do you see the rates of postpartum depression increase when we're in a stressful situation like this?
Absolutely, tenfold. So we know that anxiety will exacerbate postpartum depression. So a lot of the things that you used to do to kind of combat this, we would get out of the house, go ski with friends. And so now we have to kind of retract a little bit and realize now I have to be more careful about who I'm seeing, where I'm going, who I'm exposing myself and my baby to. And so that more isolation that we're experiencing now as a whole for our moms, that makes things a lot more difficult. And we are seeing an increase in postpartum depression in our moms today.
Is postpartum depression something that moms should ever try to handle on their own or, with the support of their family, or is it always important to seek professional help?
So when we've reached the point of postpartum depression and we're dealing with those more severe symptoms, we really need you to get back to your OB provider and let them know how you're feeling. If you need someone to kind of talk through, they're going to want to run that lab work and check your hormone levels. And then you may need some pharmacological support. So it's really important to get back to your OB provider and have that conversation with them.
What are some resources that you would recommend for both the moms who are are dealing with this postpartum depression and their partners and families?
Yeah, so our Medical City Healthcare website has a lot of great resources on it. One I would specifically point out, there's Postpartum Support International. They have a lot of resources there, from mindful meditation. There's virtual support groups there where you can go and chat with other moms who are experiencing some of the same things you are, specifically during this pandemic. Talking to moms in those same situations that honestly are probably struggling the same way that you are. And then also they will provide you access to licensed professional counselors. And there's also on our website, you'll also find the names of perinatal psychologists that specialize in moms dealing with postpartum depression. So there's a lot of great resources there.
Chris Croteau, thank you so much for joining us and being part of DFW Child's Baby Day. We appreciate you sharing your time and your expertise.
Absolutely. Thank you for your time.